Hello everyone. Today's video is a Q&A extravaganza. I'm going to rapid fire a bunch of questions here on blastocystis hominis, on LIBO, what else we have, secretory IgA, oh, this one related to blastocystis hominis, whether it's safe to do chelation therapy when we have amalgams in our mouths, questions about stomach acid, and maybe more. I can't remember what else I have up here. Oh, we have something about silver nasal spray. So just before jumping into the video, as a reminder, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And also, if at some point you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I would really appreciate it. So thanks in advance for taking a second to do that. So in no particular order here, first question is, says, will LIBO, large intestine bacterial overgrowth, cause swelling in the large intestine? It's right side lower by the hip or a bit lower. It looks like swollen intestine, feels empty when I push on it. Besides, I have low stomach acid, my stomach is bloated. Every morning I have the urge to use the toilet, but it is usually normal. So thank you for the question. Yeah, so I mean, of course, can't give any advice over social media. And quite frankly, healthcare provider should be able to palpate what you're describing here and give you a pretty good sense as to what's going on. I mean, generally speaking, with LIBO, like it certainly can feel like a lot of swelling and irritation, distension, like bloating, all that unpleasant stuff. But generally, you wouldn't see any physical like outpouchings of intestine with LIBO or any type of intestinal inflammation. Really, that would really be just quite a lot more internal. Generally speaking, in my patients, if I had a patient that came in to see me and they had like an outpouching somewhere, I'd be thinking more like, do they maybe have a hernia, or are we actually dealing with like a really swollen lymph node or something like that? But yeah, generally speaking, wouldn't see any physical outpouching of the intestines with LIBO. And then also just the way it's described here, by the hip or a bit lower. Like, I mean, when folks say hip, sometimes they mean different things. So again, just actually having someone do a physical exam would be much more valuable than me trying to guess what what one means by hip, because sometimes folks mean like the side out by like the bony part of the hip, or the front down like right at the groin where the thigh attaches to the torso. But that low down, that sounds more like hernia sort of territory. But again, have to get someone to take a look at it to kind of know for sure. So thank you for the question. I hope whatever it is gets resolved ASAP. Just gonna close that window. And the next one here is so is secretory IgA or immunoglobulin A, one of our trusty antibody types, low? Is secretory IgA low due to blastocystis hominis? So thank you for the question. It's a good question. I mean, not a lot's known, to my understanding, not a lot's known about blastocystis hominis in terms of exactly how it can impact lab parameters. I've had a couple of videos, probably the video that you posted this comment on is a video about blastocystis hominis. I posted maybe in this video or in other ones that when you actually look at the research literature on blasto, it's really debated as to whether it's even a pathogen, like it's a human parasite, but is it actually pathogenic or not? There are some clinicians and certainly some patients who say like, yes, it definitely is, and they get tested for blasto and they get treated for blasto and they feel so much better. But it's debated as to whether like it actually causes pathology or not, because of course it's like, oh, I went on antiparasitics for blasto and I felt better, and my blasto is down. It's like, yeah, fair enough, it treated the blasto, but were you maybe treating some other parasite that the test missed, or were you treating yeast? Because a lot of antiparasitics, at least herbal antiparasitics, are really good at treating yeast as well, or LIBO or something else. So it's a bit debated. So with that being said, I'm kind of on the fence. I mean, I've had patients where the only thing we found on their labs was blasto. We treated them for that. They felt better. So I think that's compelling evidence that blasto is a thing. But again, like I can't say for sure because it could have been treating something else. So I just tried to be open-minded and I just don't know. With that being said, if blasto is indeed causing a pathology, then it could cause low secretory IgA, or it could cause high secretory IgA. That's the funny thing with secretory IgA. If it's low or if it's high, it's abnormal, but both conditions could be caused by an infection of the gut. So it's kind of debatable whether that's a terribly useful parameter. But to answer the question directly, blasto could potentially cause low secretory IgA. theoretically, I'm not aware of any studies showing that it definitely is able to do that, but theoretically it could, and I think it's very plausible that it could. All right, next one here. All right, so I had a video from 2 years ago called "Can you do a stomach acid test while taking a PPI?" And so the question here from 3 weeks ago, by golly, I'm behind on the videos here on the questions. It says, I'm confused. I'm on a PPI for GERD, gastroesophageal reflux disorder, after getting rid of SIBO and H. pylori, and it's helping my burping rather. Are you saying I can add in hydrochloric acid as I'm on the PPI? I want to get off these PPIs. So good question. I'm certainly not saying anything directly via social media to say, what you should or should not do. What I will say though is that I have patients who have a lot of digestive issues and they are on a PPI, and in many cases the PPI is not causing the digestive issues. It blows my mind how well tolerated PPIs are. It's like, we're going to decimate your stomach acid, this crucial stuff that you need to digest your food, and yet it's not causing like tons of bloating and all these crazy symptoms. It oftentimes is very helpful for people to be on a PPI to help with their reflux and heartburn, and does not seem to cause any obvious day-to-day side effects or new symptoms. So anyways, long and short of it is I have patients that have digestive issues. They're on a PPI. It's maybe helping their reflux, but it's not helping their gas, bloating, etc. Sometimes they do, oftentimes they don't. And due to some of the parameters of their case, maybe they find foods just kind of sitting there in their stomach. They get nauseous easily with eating. They get full really easily. Those would be some of the clues I see with my patients that suggest they might have low stomach acid. Then I'll say, well, you've got this kind of worst of both worlds. It looks like you have too much stomach acid that's causing irritation to your gastrointestinal lining, or it's refluxing up into your throat, and yet you also seem to have not enough stomach acid to digest your food. So what I've recommended for many of my patients over the years is keep taking your PPI because it's helping, but then take stomach acid at mealtime, because the PPI is going to suppress acid all day, which is what it's supposed to do. But we want acid to break down the food. So yeah, take the PPI all day, and then take the stomach acid supplement, betaine hydrochloride, at mealtime to help digest the food, and we get the best of both worlds. So that usually is a successful strategy for a lot of my patients, but it is one of those things where there's certain conditions, like if someone, say, had something called Barrett's esophagus, or if they had gastritis, or they had a duodenal ulcer, certain things might preclude them from safely being able to take that betaine hydrochloride alongside their PPI. So anyways, again, not giving any advice here, but there are certain reasons why I would not prescribe that to a patient. So it's not just a by and large definitely safe thing to do. It's case by case. Same person also posted a question on the same video saying, do I like to use hydrochloric acid with pepsin, so this enzyme that's produced in the stomach? And I don't really find it matters one way or the other. The one that we have here, we use the Designs for Health brand, no affiliation with that. That's just the company we happen to use. 750 milligrams of betaine hydrochloride per capsule. You can't beat that dose. Just means fewer capsules that the patient has to swallow. I think it has pepsin in it. I don't remember. I don't really find it makes much of a difference, to be honest. So I have no preference one way or the other. And is EDTA safe for use? So EDTA being a chelating agent to remove heavy metals in the body. Is EDTA safe to use in people with existing mercury amalgams, say 5 or 6 in the mouth, or would it pull mercury into the body? So I've posted other videos about this before. I don't remember if I have one that's specifically entitled that. So anyways, the punchline is that in my experience, I find that it with my patients in my practice, I have no reservations about using EDTA with folks that have amalgam fillings, because I do not find that it meaningfully pulls the mercury out of those amalgam fillings. The mercury, in my opinion, to my understanding, it's very sequestered. It's like a really, really hard rock, embedded in the tooth. And I think the EDTA at most is going to be maybe like a little, pinky fingernail just trying to scrape at a boulder, trying to see how much is going to come off. Yeah, maybe a little tiny bit of rock dust is going to come off, but really nothing meaningful in any way, shape, or form. So I don't think that it's a problem. So I don't think it's a contraindication, at least in my experience. The very last thing, actually, no, I'm going to have to save this for another video. I'm running the bend on my time here, so I'll save the silver note for a future video. I tried to cram too much into this one. I hope this was of interest. If you have any questions or comments on these topics or anything else, please post in the comment section below. I'll do my best to answer as soon as I can.